Hi everyone. Today we are privileged to welcome a visionary in the field of orthopathology, oral pathology, a clinician, educator, diagnostic expert who has redefined the role of an oral pathologist in private practice. Dr. Pratik N. Patel, a proud postgraduate from Manipal University, earned his MDS in oral pathology in 2015. His academic journey was marked by excellency. His research on type 2 diabetes oral candidiasis not only secured an ICMR grant but also won him the Best Research Paper Award at Manipal. Since then, he has been a pioneer in exclusive oral pathology practice in South Gujarat, establishing a strong diagnostic presence through three advanced oral diagnostic centers in Surat, known as Sangi Oral Pathology Center, Oroscan Diagnostics, and ScanX Dental Diagnostic Center. Well, with his dedication to innovation, he became only the second practitioner in Gujarat to introduce Chowkron PRF technology into clinical use. Pratik Patel's passion for early detection of oral cancer, combined with his hands-on experience and academic commitment, makes him an invaluable guide for students, professionals navigating the specialty. So, as we delve into important questions from how to choose oral pathology as career to understanding the MDS curriculum, clinical exposure, fellowships, and more, we are actually in the expert hands. So please join me in warmly welcoming Dr. Pratik N. Patel, a pathologist, a pioneer, and an inspiration for next generation of dental professionals.
Thank you so much, Anisha, for this wonderful introduction. Thank you.
So my
And I am so thankful for providing this platform as well. So to add any value to our budding clinicians, dentists, and those who aspire to start their journey in the field of post-graduation. Yes, please.
Thank you, sir. So my first question to you is like, what first ignited your passion for oral pathology? Was there any specific case, microscopic slide, or a mentor who inspired you to pursue MDS in oral pathology?
No, even just like most of us, I also cleared my third year oral pathology exam by seeing the slide outside of microscope. The slide which was cracked was called polyp, and the slide which was having the some sort of particular mark was some dental pathology like that only. So what ignited me, if I briefly share my journey, that the one thing I was very sure after in my internship of dentistry that I wanted to pursue. Post graduation, and of course we all dream about ortho, oral surgery, or any of clinical fields. And when I worked hard, that I dedicated one entire year plus one internship year for preparation only. So I was firm in my mind that whatever happens, but I'll take seats according to merits only. So in our time, there was no need. We had to appear in various exams like AIPG was there, AIMS was there, COMED, AMU, PMDC, you name it. And so when I cleared exams, so my merits were like that I will get any sort of either oral medicine or oral pathology. So little disappointed, I was I was having my resume and I was meeting clinicians in Surat. But when they came to know that I'm getting in Manipal, so they told me, and one of the person whom I highly admire, oral surgeon, so he actually asked me that if you are getting Manipal and if it is oral pathology or oral medicine, you must do it. So that was a push for me that I said yes, that I'll appear in counseling and then I choose oral pathology. So till the date, I was just same as you all are probably. And I can see Anisha in this stage, so I was not at all as smart as like her or anybody else. So I consider you guys pretty smarter than me. And that was the first part of the question, that why did I choose oral pathology? So it was inspired by an oral surgeon. I'll name everybody who has helped me in the journey. So he's Dr. Nehal Patel. You search it. He's one of the first arthroscopic, but he does TMJ arthroscopy, and he's pioneer in India. So he told me, and with God grace, I was in touch with him. So second, when I completed oral pathology, I did not have any vision that what will I do. And for me, oral pathology is equal to academy or college. So I was roaming around in all the colleges, again having resume in my hand. And then one fine day, it just clicked me that what does endodontists do? They do RCT. Why? They're trained to do so. So what am I doing? I should do, and I must start oral pathology because I'm trained to do so. And that's how I started my journey since 2015. Yes.
So, some students think that they're not very confident in clinical procedures during BDS. So, can they still choose oral pathology? And how much of the BDS clinical experience plays a role in oral pathology? And does it affect the success in the specialty?
A lot. If they are considering to pursue oral pathology without much of clinical knowledge, that they were not so good in clinical or handwork, they will pursue oral pathology. Guys, let's not make a mistake, because those carving was anyways part of oral pathology only. So more than that, I'll share my hardcore clinical clinician experience, and we correlate a lot. You understand this line, that this is anatomy physiology, and then it travels towards the disease. So this is pathology. And what comes in between is our biochemistry, our endodontics, our root, ortho, oral surgery comes everything in between. So they take patient from pathology to anatomy physiology again. So we must have a good clinical knowledge. It's it's mandatory to be a good oral pathology. We must know all clinical subjects as well as our academical subject. But yes, to say so, we can train ourselves any day. So if you are pursuing oral pathology and if you don't have any, you think that you have this weakness, it's good actually that you know, because what matters the most, that we sometimes we don't know. So it is good that we know that we are not knowing clinical stuff. We will work on it, and then you can pursue it.
So, sir, what does MDS oral pathology and microbiology curriculum truly involve? What can we students expect, like the key academic and the practical components covered in the each year? Like, what will we learn and do in first year, second year, and third year, respectively, sir?
Okay, so I'll cut short it everything, and most of the things don't change just like that. So the name itself is like oral. And, see how long it says, that oral and maxillofacial pathology, microbiology, and forensic odontology. So it comprises all of them. And just like most of our other friends, those who are pursuing like endodontics and orthodontics and oral surgery, the first year comprises of basic stuff. So basic includes from anatomy, physiology, pharmacology, and biochemistry. So so in first year we may get postings in all these things, along with we call it community medicine. So our preventive, not just PCM or preventive community medicine, but in that we will come under biostatistics also we are supposed to know. So these all things happens in first year, that we get groomed. And second, in first year only we get exposed to some basic task of oral pathology department, like having students under us, that is first and third year students taking some classes. So these are practical and theoretical part of first year. You will observe that oral pathology students pursue their thesis very decently. In other clinical branch also they do it, no doubt about it. But for oral pathology, thesis is their heart actually. So they start their thesis almost at the end of either first year or beginning of the second year. So second year is almost dedicated Uh, so that doesn't mean that throughout the year you do one thing only. Of course, those tasks that the students allotted to you, the lectures allotted to you, the seminars, journal clubs, that keep on going. But thesis is the main part. So in first year only, you have written the raw material or the draft of your thesis, and in second year you start working on it. You have in second year, you mostly you don't get postings. Most of the time we spend in the department. We do exfoliative cytology. We explore various staining techniques to detect many diseases. So these all things are academical and practical part of second year. In third year now we are called, and all of the third year students will be called exam going postgraduate, so EGPG. So you become exam going postgraduate student, and apart from ragging, you do what? So you, of course, the thesis is over. So the presentation of it will be in the form of book, and the third year will have postings, or even in second year, sometimes you get the postings of dermatology, to get exposed to our skin related. So oromucosal diseases like pemphigus and lichen planus, you get chance to see them and how to treat them, various staining procedures happening there in their department like fluorescence microscopy. So these all are covered in third year. You also get posting in general pathology as well. So you are groomed well in oral pathology in first, second, and third year. So, and in third year, of course, if the college, if get a chance in this talk, we will talk about college as well. If you get chance, then you get oral medicine posting as well, so you get chance to see the patient. In some of colleges I have observed that the oral pathology students don't even get chance to see any patient. So third year is comprising all of this, quite practical, quite practical.
Wow, so that's like you have explained every year so nicely and so in a crisp manner. Thank you so much, sir.
It seems Anisha may transfer it to oral pathology, is it so? Cool.
Uh, so, which foundational subjects or skills should a student strengthen before joining oral pathology? Would you recommend brushing up more on histology or general path or any specific diagnostic techniques? What can put one be the upcoming oral pathologist one step ahead and be super sharp?
Cool. So I don't know. I'll tell you very practical answer actually. Now you will, if you are pursuing any course, so your ultimate aim would be to not just to earn respect in this society, or be be, I mean, a good child of your parent, but also to earn bread and butter. So let us be very practical on that ground. So if we are if you have cleared your NEET exam, and if you are getting your oral pathology seat, first say thank to God and celebrate that you are one of those lucky persons. They have got postgraduate, I mean, chance to pursue this position course. Second, rather than focusing, I mean, taking out that BD Chaurasia again or Gray's Anatomy again, I would rather suggest, as I previously mentioned, uh, visit some clinics where you can see the patient, because more you correlate your theoretical stuff to your practical approach, uh, the books and the knowledge is useless. So rather than, I mean, I won't say the pathology or anatomy or histology, of course we should be well versed about it, but that's what we are going to do in next 1,000 years, means next 3 years we are going to do the same. So let us brush up the clinical stuff, because what I did, that when I was preparing myself to appear for entrance exam of post graduation, I used to read 17, 18 hours. I didn't go out of my home. So that one entire year, I didn't see any patient. So and I'm sure the competition is equally tough nowadays. So when you are preparing, you focus on NEET preparation, and if you have got the seat, if you have some time, visit clinics.
Okay, so what's the difference in exposure between the like government college and the private colleges for the oral pathology? Do students in private colleges miss out any biopsy cases or lab work in comparison to the government college? And any tips for those who are trying to choose between the institution?
Yeah, very good question actually. And let me be again very practical and because uh, most of students uh, they don't born with silver spoon. So their parents have worked hard to pay the fees of BDS, and in nowadays BDS, of course, 1 year is around 3 to 5 lakhs. So almost 50 lakh rupees, because 25 is academic. I mean, 20 to 25 lakhs is academic fees. Then the hostel fees and the routine expenses, you sum up, and it will end up in this money only. So if you are now going to pursue the field which requires even higher fees, you must calculate the return of interest as well. It is not just that I am Gujarati, so asking you to focus on money, but that's the part and harsh reality, because if you spend 1 CR before you earn a single penny, and if you are not sure, or if you are not in love with the stream that you are choosing, no matter you take government college or self-finance college, it doesn't make any difference, rather than making the scenario very worse actually. So first calculate it on your part, and then coming to the answer that I'm asked, that whether to choose a government one or a self-finance one. So guys, I truly believe that you must cross check actually before taking any college. Cross check what? Some few things. One, our oral pathology students will get a chance to see patient. One, how what is the flow of OPD, because this matters a lot. And what are, or how interested the academicians or the staff members of the college interested to teach. Because I am so fortunate that I was guided by Dr. Raghu Radhakrishnan, and he is one of the 6 authors of Schaefer, the very textbook that we read, right? So that's what we it make me today what I am. And he taught me not just about oral pathology, but how to be in the society, how to be when I am on the other side of the table, right? So this means a lot, because I have seen, I'll be blunt here, I have seen postgraduate student gifting iPhone to their guides. I have also seen that they, I mean, what not, and this is not relevant to any government or a self-finance college, right? So you choose it very wisely. Otherwise, if you take any college, like I was studied in self-finance, so why did I choose? Because I was clear about it, that I'll get this much of stipend, my father have to spend this much, and that's it. So you be clear with your number of the money going to be spent, number of the patients that you are going to be seen, and the person or probably persons by whom you are going to be trained. Otherwise it doesn't make any difference whether you are government pass out or private pass out.
So that's a very big clarity of vision, sir, on how to choose between a private and a government. Thank you for sharing, sir. So, are there any fellowships or additional training necessary after MDS in oral pathology? If yes, what kind of fellowships or certifications like forensic odontology or molecular diagnosis would you recommend, and why?
Okay, so very nice question actually, because frankly speaking, the answer is no. That when you have passed oral pathology, no, so if you want to start practicing oral pathology, you may not need any other fellowship programs, because as I said, it encompass everything. If you have done homework very well, if you have done your post graduation very well, with God grace, you are blessed with people around, then you won't need anything. And from the next day onward, because I was dumb actually, you can call me like that, I didn't have vision like this. But if you have got something from this talk and you understand what I'm trying to say, that if you are going to practice, start your private practice, no one can stop you to roar like that. Okay, so there is only one course that I will suggest everyone including those my friends who are pursuing other fields, oral surgery or root canal, prostho, whatever their field is. You must do this one course after your post graduation, and that is a Life Excel course conducted by Dr. Sujit Pardeshi. Why? That also I tell you, because in colleges you are given patient according to roll number. Are you going to get patient in your city according to your roll number? No. No matter how good you have your clinical knowledge, no matter how good your handwork is, you will get chance to show it to patient and earn money only when patient will tell yes to your treatment plan. Otherwise, you will meet 98% of clinician. They will tell you that I told patient to go for this higher crown and they took medicine only and ran away from the practice. Right? If you want to become those 2%, that you tell patient understand and say yes to your treatment plan, and then only your hard, I mean, this training, your pursue and everything will give you fruit. So this is the course, the Life Excel course conducted by Dr. Sujit Pardesi. And if there is any other course that sir conducts for soft skill enhancement or your grooming part, you must do that. You must do that.
So, in your view, what makes an oral pathologist truly stand out? Is it a diagnostic acumen, research work, publications, teaching skills, or a combination of all? Like, what kind of a vision a postgraduate should have once they enter for the next 3 years? What kind of vision they should have? Like, after I pass out, this is how I should be. This is what I should be in master of. Can you please enlighten your knowledge in this, sir?
Yeah, sure. So, Anisha, if I get chance to go back to my time, what will I do? So that's actually an experience call, right? That you learn from somebody's mistake. And very nice question. So, what would I have done? And I would have done my SWOT analysis. So, what is SWOT that I just mentioned? You make a cross, you write down your strength and weaknesses first. And for the next 3 years, so obviously, I want everyone to empty their cup. And no matter, I mean, if you don't know anything, that will be fine. Actually, your mentors will be able to teach you something. So you try to find out your strength, whether you are good academician, you can teach your students well, your handwork is good, your staining is good, you are good in experimentation. What are you good at? So you identify your strength, as many strength as possible. At the same time, you find out your weaknesses. What is the weakness? Whether I'm not fluent in my speech, then that means the academy option is gone, right? If I am not so much interested in clinical stuff, that means the private practice option is gone. If I am very good in my thesis, or if I'm very good in experimentation, if I'm very good in book knowledge as well as advanced stuff, that means I should go for research stuff. So that's how you do your homework. You identify your strength and weaknesses. And I know many friends, those strength were research, so they have changed their cities, they have changed their not so field, but they don't practice. They work in a higher setup where the molecular researches are done. They have moved to from India to USA just for the research purpose. So that benefit is there in oral pathology that probably nobody in no other fields it is given, right? Then comes that what makes us stand out. So that the correlation of things makes us stand out. If you are talking about private practice, the correlation of things, because when you have brush up your clinical stuff, if your college allows you to see the patient, that means you have done your clinical work, and now you are correlating it with whatever you are seeing under the microscope. So nobody else can see the pink and blue or the pink and purple color, right? That makes us outstanding. Not just a diagnostic acumen, right? You need to correlate those things. As a diagnostician, this makes us stand out. And if we have done our post graduation well, then the research options are anyways open. So that is anyways outstanding. So try to identify your strength, your interest, and not so strength or weaknesses. And that will as O and T, means strength, weakness, opportunity, and threats. So it will tell us about opportunities, where I can go, which options are available for me, or how big vision should I have. So with God grace, I practice exclusive oral pathology since 2015. I haven't touched aorta, that means, and still we have a good portfolio. So with God grace, we make money as well. So this is my vision, that and my mission is to make oral cancer free India. I want to make the India oral cancer free, and that's how we work on earliest detection of oral cancer. So this speaks about my private taste, and if you are into some research, or you have interest about this will become your horizon.
So, thank you so much for sharing your time, your wisdom, experience with us today. Your journey is not only inspiring, but it is like an eye opening for students and young professionals who are considering a career in oral pathology. Your clarity on the scope of the specialty, the honest insights into the MDS curriculum, and guidance on practical skills, fellowships, and the diagnostic innovations have truly added immense value to this conversation. You have shown us that oral pathology is not just a subject, it is vital. It is an evolving branch that blends science, precision, and purpose. Like you have said, you wanted cancer free India. And we are incredibly grateful for your contributions to the field and for being a role model to many. Thank you once again, sir, for joining us and for being such a passionate advocate for early diagnosis and excellence in oral healthcare, sir. You are an amazing and also an inspiration for me also today.
Thank you so much, and thank you everyone, those who are seeing this conversation. Thank you all for this patient listening, and wish you the best of the life, and may God bless you with all the happiness and success. Thank you so much, Anisha. Wish you the same.
Thank you, sir.